My name is Amanda Johnson, and this is my first patient for acute care in the UT El Paso Adult Geriatric Acute Care Nurse Practitioner Program. So I have Miss S.A., a 21-year-old female that was brought into the ER for overdose on her home medications of Zyprexa and Remeron. She took 5 of each pills. She ended up having a fight with her stepdad that he said that she was not wanted in the house anymore. So she wanted to take the medication to just sleep, just go to sleep. We do not know the time that she took the pills to the time that she arrived in the ER, and I do not know if EMS was called or if somebody brought her up or how she actually got to the ER. We have a past medical history which is unknown, but we know that she has some psych history due to the fact that she is prescribed Zyprexa and Remeron. But she is very non-interactive, just answering yes or no questions when she wants to. We have a past surgical history of C-section. We have unknown family history. We just know that she does have a stepfather. And we have a social history of she smokes a quarter of a pack a day for 2 years. She drinks socially, and she does do marijuana, methamphetamines, and cocaine. Her home medications that we know of are the Zyprexa and Remeron. We do not know if there's anything else that she is prescribed, and she has no known drug allergies. Review system was unable to obtain. She would not interact with me enough to answer any of my questions to find anything out. But on physical exam, we've got she is poor dress and poor hygiene. Her head is normocephalic and atraumatic. Her nose, mouth, and throat no oropharyngeal exudate. Her eyes' pupils are equal, round, and reactive to light. Right eye exhibits no discharge. Left eye exhibits no discharge also. Cardiovascular, normal rate and rhythm. No murmurs or gallops heard. Pulmonary effort is normal, and breath sounds are normal also. No cough or anything like that. Musculoskeletal, normal range of motion when we were able to get her to move around. Neurological, no cranial nerve deficits. She does have a very flat effect and blunt, and she will awake easily to stimulation, but she won't open her eyes. She just shakes her head yes or no when asking questions, or she'll get to the point that she doesn't want to interact with you anymore, and she will turn the other way in the bed. On her labs, we've got pretty much everything was normal, within normal limits. WBCs were 4.1, RBCs were 4.36, hemoglobin was 12.8, her hematocrit was 35.2, glucose was 99, bun was 8, creat was 0.56. Her potassium was a little bit low at 3.3, so we did replace that with 40 units of potassium. We're doing potassium acetate right now. CO2 was 23. Everything else was normal. MAG was 2.2. FOS was 4.4. Because this was an overdose, there was no microbiology pulled, but we did get a EKG on her. We wanted to monitor her QT to make sure that the Zyprexa and Remeron did not widen her QT. So the plan with her was to consult psych to come talk to her. We put her with a one-to-one sitter to make sure that she does not harm herself. We were watching EKG's Q4 to look for any rhythm changes or widening of her QT interval. We were also really monitoring her neuro for any chance of reduction in waking up to stimuli, because that would mean we would intubate her to protect her airway until the sleepiness of the symptoms of the Remeron and the Zyprexa wear off. So that's it for my first patient. Thank you.